Right, it's time to get to some health news, and this past Monday was what they call Blue Monday, where after all the holiday festivities, many people experience a letdown or even depression, and that can affect your health, of course. Joining me with today's Midday Health Check is Dr. David Winter of Baylor Scott and White. Pardon me, I say that all the time, and I don't know how I'm screwing that up. Good morning, Dr. Winter.
Good morning, Tashara. Good to be with you.
Look, we want to start with Blue Monday. New studies suggest that a decrease in activities can actually increase the risk of dementia. First, let me get to Blue Monday. Tell me about that, Dr. Winter.
Yeah, a new study actually says there is indeed an association. If you are actively socially, if you have a lot of close friends you share thoughts with, there's a 28% decreased risk of dementia over a 9-year span. The risk factors, they say, are living alone, having none or one person you share ideas with, you need more than that, or having less involvement or no involvement with social activities, social groups, even religious activities. So it's almost like socialization is for the brain what exercise is for the muscles. So if your muscles are pumped up with walking, with jogging, within the gym, that's good for your muscles. Socialization is good for your brain and may even decrease your risk of dementia.
Okay, you have talked in the past about the importance of flu and COVID vaccinations. How about vaccines for young children? We've heard that vaccinations for children are actually declining.
Yeah, they are declining. A couple years ago, 95% of all kindergarten children had been vaccinated. It's down to 93% right now, and that's 250,000 kids that are not protected. We have to remember these vaccines work well. Most childhood illnesses are minimal right now in America. Measles is coming back, polio is coming back, especially up in New York State. And all of these are coming back because those kids are not vaccinated. So we hope parents will understand vaccines do help save lives and prevent a lot of illnesses.
Okay, how about cancer? How are we doing with cancer in this country right now?
Yeah, that's a better story. If you look back 20 years ago, in these past 20 years, the incidence of cancer deaths is down by 1/3. Now, 3 reasons for that. First, screenings. Pap smears, mammograms, colon cancer screening. That finds cancer early when it's treatable and curable. Also, new drugs are out. So a lot of cancer now can be treated very well with cancer drugs. Not all of them, but a lot of them more so than we had 20 years ago. And also vaccines play a role. So there's this human papillomavirus, HPV they call it, that causes cancer of the cervix in women. If you get a vaccine, your chance of getting that is down 65%. So good news with cancer, but keep out there with surveying and going to see your doctor and getting those vaccines.
Absolutely. Okay, so true or false, chicken soup can actually help us recover more quickly from the common cold. And before I get into that, I had some severe allergies yesterday, which just bothering me. And I heard this twice, get you some chicken noodle soup when you get home. True or false, does it help with the common cold or anything for that matter?
You know, there's actually a study that looked at this, Tashara. It's interesting. They took some human white blood cells in the laboratory, exposed them to chicken soup, and the white cells had a less response, inflammatory response, which made people, we think, have less symptoms and maybe even get well quicker. Now, dietitians will say, well, chicken soup, that's good for you. It's nutritious, it's filling. It also can help you with your sinuses. The warm aroma there thins the mucus there, so that's a good thing. So how good is it? Is this a magic cure? No. Is the science really strong here? Not really, no. But you know, it makes you feel better. At least it makes me feel better when I eat chicken soup, so I do recommend it for the common cold.
Okay, I at least want to give him some props then. The doctor told me that it's okay to go ahead and eat a little chicken noodle soup. All right, Dr. David Winter, thank you so much.
Indeed.